Hi, my name is Anna, and today we have a very special guest with us, Dr. Andrew Galma. He is the Chief of Cardiology Fellowship from North Shore Hospital. Thank you for coming.
Thank you for having me.
So, I have a couple of questions for you. First of all, do you find yourself using math on a daily basis when practicing cardiology?
That's an excellent question. On a daily basis, I encounter math with most of the patients that I see. Math helps me make important clinical decisions about my patients, and I use even the simplest algebraic math that I learned in junior high school to make some of these decisions.
And how do you use math that you learned in junior high and high school and college and medical school in cardiology?
So that's a very good question. I'll give you an example. The heart has a main valve, it's called the aortic valve, and it carries blood from the heart to the rest of the body. And in some patients who are older or have high blood pressure, that valve gets very tight, or what we call stenosed. And we take pictures of that valve, and the question is, what's the size of the valve? And I use an equation called the continuity equation, which is simple algebra, to give me an understanding of what the valve size is like.
So, can you tell us a little bit more about this continuity equation?
Sure. So, using an echocardiogram, which is basically pictures of the heart, we get three important pieces of information, all of which we can measure and calculate. Using those three pieces of information, plugging it into the continuity equation, we can solve for the fourth variable, which is the aortic valve size. Based on that size, I can pick my treatment, whether we treat this with medicines or whether someone needs an operation.
So, I've heard that in the continuity equation, you use area of a circle?
Yes.
How is that involved?
So the area of a circle is pi r squared, as we all know. And we're assuming that the aortic valve is a perfect circle. But as we all know, nothing really in the body is a perfect circle, and neither is the aortic valve. But we assume it to be. So even though the continuity equation gives us a lot of information, sometimes there are drawbacks.
What are some other examples of flaws in the equation?
So we are making a lot of assumptions about the size and the shape of the valve, but more or less the equation is very useful in determining how to best treat the patient.
So you're saying that the equation helps to find how severe the stenosis is?
That's correct.
So if we didn't have the equation, then we wouldn't be able to figure out whether the patient would have to undergo surgery or not.
It's a very helpful equation that I use on a daily basis with the help of simple math to help determine how to treat my patients.
So I have one more last question for you. How would cardiology be different without math?
Oh, I don't know if I would be able to practice cardiology without math. Math is such an integral part of my daily practice that I don't think it would be fair to offer patients proper treatment without math. I really wouldn't know where to go or where to start. I think it's one of the most important fields to learn, not only at my stage, but at a younger stage, even in the elementary school level.
So there are many other fields of medicine. How would those other fields be different without math too?
So, besides cardiology, I think even going outside the medical realm, no matter where you go and where you practice or work, you're going to be exposed to math, whether you're an engineer, an architect, an accountant. You're going to be dealing with math at all times in life. So I think it's one of the core values that you should have and entertain.
Well, thank you for speaking. It was a pleasure meeting you, and thank you for sharing what you know.